So every day, start each day with a surgical scrub, and that's Laura using a scrub and betadine, making sure she's getting all the loose skin and any dirt under the fingernails, and make sure you have a really super good scrub to start the day. After that, you can use good hand hygiene in between cases with things that might be in the room if you are fortunate enough to have Avogard or all care foam. If not, you can use isopropyl alcohol works, but just make sure you do good hand hygiene between gloving. And you'll want to next guard your sterile field. So now at home, we protect the entire room. The whole environment is something that we care about, but that doesn't work in missions, and so we have a different mindset. And our mindset really is to just be careful of what is sterile in the room. So it's the eye, the surgical site, it's your Mayo stand, and it's the back table. Those are your sterile fields, and those are the things you're going to be concerned with. Stay alert and respond quickly. I think if you hear the surgeon clearing his throat or tapping his foot, we have one guy that does that, then you know that you need to be on your best game here. So they really don't want to be waiting for you to figure things out. So you have to stay alert. And then verifying sterility, this has to do with the instruments. The sterile field is your domain. You are the infection control preventionist. That is your role there. Making sure that nothing gets put on your sterile field by anyone or yourself that isn't sterile. So checking the disposable items, the package to make sure it has integrity before it's opened. Checking the chemical indicator in the instrument sets, making sure it was acceptable. If you don't know how to read these, make sure you'll know that before you go. Probably you already know. When white turns black, that's a good thing. Okay. Also, you want to learn your instruments as much as possible before a trip. This picture is a VOI set, I believe, and it's nicely labeled, so that would be available for anyone to learn. Learn the names of the instruments. It's going to be, put you a step ahead. If you don't, it's okay. You'll learn them that first day. But this is going to be the best way. Maybe make flashcards or just study this photo. And then once you feel like you have learned those instruments, you need to relearn. Go ahead and stay humble, because the real name of an instrument, whatever the doctor calls it. Okay, so absolutely. And they have lots of names. So you might call it a .12 and the doctor might call it that, and you have to know that's what he calls it. And I think the blades are the thing that we've encountered the most, because like the side port could be called a side port, a sharp point, a 15 degree, all kinds of names. So just really get in tune with your doctor's lingo. Okay. And then keep track of, handle all items safely. In the orientation they will be used. We did talk about that a little bit. Keeping track of your sharps is also really important. And you need to know what sharps might even possibly be on your Mayo stand, because someone else might have put them there as well, and you don't want to get poked. Now, sharps need to be disposed of. They need to be disposed of safely. Sometimes you might not have a sharps container, so just make one. This was one my son created for us. It worked very well. We've even used cardboard. We use whatever we can. We just make sure it's labeled. The other thing with sharps that I would mention, one trip that I was on, we went to Kenya, and we were not in a medical facility. So we actually turned a girls' dormitory room into an OR, and that had, some challenges. But the dormitory room was on a school compound. And at the end of the trip, we packed up our sharps container, which I had brought with us, and we said, okay, now what do we do with this now? Because typically there would be a service that would take care of that in a hospital. But because of the environment, and because we asked and found out that all trash gets burned in the corner of the compound, and where the children and the animals can access it, we realized we really had to, tape up that and bring it home with us. And thankfully, security didn't notice it when we were passing. I don't know what they would have done if they found dirty sharps container, but to be responsible with that and not just leave it behind for someone else to deal with.